It's a very important question whether the irreversible pan-HER inhibitors will be effective in patients whose lung cancer has an EGFR mutation. It's an area of very active investigation right now. So there are several drugs that are what are called pan-HER inhibitors, and that's different than the EGFR inhibitors that we've had until now. Until now, the EGFR inhibitors that have been studied have been gefitinib and erlotinib, which is approved in the United States for use in patients whose cancers have EGFR mutations. Those drugs target specifically EGFR. The drugs we're talking about, the pan-HER drugs, target not just EGFR, but also other molecules in that same class, but additionally not just EGFR, also the proteins such as HER2, 3, and 4. And different drugs target different ones specifically. So they're different. They don't just target EGFR, they target others. Whether that's important or not remains to be determined. We are starting to get some data with those drugs. The one that we have the most data on is afatinib. Afatinib targets EGFR as well as HER2 and HER4. So afatinib is now approved for patients with EGFR mutations in lung cancer. And it does appear to be very effective compared to chemotherapy. Whether it's as effective or more effective potentially than the standard treatments that we've been using for EGFR, specifically erlotinib or gefitinib, we actually don't know yet. There are studies ongoing comparing the two, and whether it will be beneficial for patients to target more than just EGFR, we're not sure yet. We're still waiting for that data. Theoretically, it may be beneficial. There are some studies from the lab that show that it really could have good benefit for patients because you're not just targeting the one molecule, you're targeting multiple. But in terms of clinical activity and whether it's clinically better in patients than just the drugs that target just EGFR, we're not sure. We're still waiting to see.